The iNNOVATE trial is a prospective randomized trial for patients with symptomatic Waldenströms Macroglobulinemia. Both previously treated and newly diagnosed symptomatic patients were included, and they were randomized to receive either rituximab with placebo or ibrutinib with rituximab. The main endpoint was progression-free survival. Secondary endpoints were overall survival, response rate, improvement of hemoglobin. With a median, at the first interim analysis, with a median follow-up of 29 months, we're very happy to see very positive data as far as progression-free survival is concerned. The median for rituximab and the placebo was 20 months, whereas it improved to a very extensive degree in the investigational arm with a hazard ratio of 0.2, which means that there is an 80% probability of reduction of the risk of progression or death if the patient is being treated with the combination of rituximab and ibrutinib. The regimens both regimens were well tolerated. What we observed is that when ibrutinib was added to rituximab, we did not see the infusion reactions that sometimes occur with rituximab. We didn't see the IgM flare, which is a temporary IgM increase after infusion of the rituximab. So these were abrogated by the combination. With the combination, we had some cases of hypertension and atrial fibrillation. The rate of discontinuation of treatment was equally low, below 5% in both treatment arms. I think in the future we would like to see whether the addition of a third agent, this could be venetoclax or a proteasome inhibitor such as calfizomib or even bendamustine, whether we could develop a regimen that will have a fixed duration of treatment, not to give to the patients indefinitely ibrutinib, because this is a chronic disease and patient survival is quite long. So we would like to develop a potent treatment that will induce deep responses, but with a fixed duration of period. I believe that ibrutinib and rituximab is a combination that could be used in Europe, because usually rituximab is reimbursed and ibrutinib is approved. So this is a combination that could be used tomorrow by the practicing physicians.